20 years ago, when we looked at mining, when they were testing for cannabis, we saw actually a shift to people starting to use meth because the detection window was less, which potentially, is a more harmful substance than cannabis. We really need to be very careful as to, okay, we need to think this through so people are not shifting, for example, to more harmful substances. And also what we see is that there is a risk that people will actually stop reporting minor incidents because they don't want to be tested. So even in certain safety-sensitive areas where potentially drug testing would be justified, it is still very important that then comes with a very comprehensive alcohol and other drug policy where support is at the forefront for these people.
If you're flying up to Sydney Qantas and you know that you're pilot of your 737 inhaled cannabis for their chronic pain 2 hours ago or the night before, how does that make you feel? I mean, that's a question I ask myself. And I would say that when it comes to these highly safety sensitive positions, we want to ensure that there's a long interval between THC medicine administration and the performance of a safety sensitive task. I think it's reasonable to expect that we have got broad brushstrokes in terms of the amount of time that you should wait before performing driving, for example. But if you're working on a blast site on a mine or driving a train with 500 people on it or flying a 737, maybe we push it out that little bit further just to be sure. But my Qantas pilot, if he or she is using THC for insomnia or pain, I'm quite comfortable with 12 hours. If they used that at 8 p.m. last night and the flight's 8 a.m., I'm fine with that. There's nothing in the literature. I would comprehensively review that literature that suggests that there's a problem there. And I think these are very common sense interventions that are evidence-based and that could provide a much more nuanced public health message around medicinal cannabis use and recreational cannabis use for that matter.